Hi, thank you for inviting me to present today. I'm Valerie and I work for Midlands Connect. And until recently, I was Policy Officer at Midlands Connect, and in that role I managed a great project on the future of rural mobility, and that's what I'll be talking about today. But first, just a few words about Midlands Connect. We are the subnational transport body for the Midlands and the transport voice of the region. We turn evidence into investment for projects that deliver economic, social and environmental benefits, both for the region and for the UK. We're a partnership that includes local authorities, local enterprise partnerships, chambers of commerce, the 2 airports, Highways England, Network Rail, and our funders, the Department for Transport. So I'd like to provide an overview of our Future of Rural Mobility study, with consideration for how technology could solve some of the mobility needs for our rural areas and our communities that live within them. Nationally, consideration of the future of mobility has been very much orientated towards our cities. We recognised a gap and decided to assess the transport and accessibility needs of our more rural areas. Our rural areas in the Midlands are scattered from Nottinghamshire and Leicestershire in the centre of our patch, to Shropshire and Herefordshire on the west, bordering with Wales, Worcestershire to the south, Staffordshire to the north, and Lincolnshire across to the Lincolnshire coast. We commissioned the study on behalf of a number of our partners, including Shropshire Council. The Council, 3 other councils, and 1 local enterprise partnership were all represented on the project board and took an active role in advising and steering the study. We appointed the University of Lincoln, and the study focused on the human and business needs in our rural areas, and only then considered the options and technical innovations which could address those needs. We wanted to consider how we could have greater equality of access. The aim was then to produce a toolkit or a menu of options to support colleagues developing new policies and projects for rural transport. We did a great deal of stakeholder engagement during the course of the study. The Rural Services Network very kindly hosted an online survey for us, which gained over 170 responses. The highest responses in terms of needs were public transport and broadband and mobile coverage, but the study treated them as a means to addressing other rural needs, the key ones being access to local services including post offices, shops and pubs, access to adequate healthcare and affordable housing. We hosted a number of workshops, with local ones in Lincoln and Hereford and a regional one in Birmingham, all with a really good turnout. Our attendees included a wide range of individuals and organisations. So we had an agricultural chaplain, we had community representatives, rail lobby groups, the NHS, Public Health England, and 2 other subnational transport bodies. There was then also a special workshop for sixth form students in Lincolnshire to gain their particular input. The university also did a number of interviews with local authorities, with residents and community groups, businesses, a housing association, the National Centre for Rural Health, which is in Lincolnshire, academics, and also experts from the transport sector. In total, we estimate that approximately 300 people were involved in that process. The study illustrates that rural areas differ from urban areas, and also that our rural areas are not homogeneous. The manufacturing and construction sectors are bigger shares of the rural economy than in urban areas. Tourism and agriculture are also important aspects of the rural economy. We have protected natural environments, including areas of outstanding natural beauty and the Peak District National Park, valued both for their biodiversity and tourism in terms of access to green open space. Some rural areas are relatively close to a town or urban centre for service provision, others very much more remote. In terms of population density, Herefordshire has the 4th lowest population density in England at 0.87 people per hectare. 24% of the rural population is over 65, compared to 16% in urban areas. Bus services have been reduced in recent years, particularly in rural areas. When transport planners talk about the last mile of journeys, the last mile in the rural setting can be considerably further than an actual mile. What we're talking about here is that very last bit of the journey, so from the bus stop to the office or from the train station to your home, for example. Rural communities have fewer transport choices and are more reliant on private cars. They are further from education provision and from healthcare, so on average it takes twice as long to get to secondary schools and hospitals, which results in patients holding off from making appointment, resulting in later diagnoses of serious illnesses, with knock-on impacts on their health and the cost to the health provider as well. It also results in students potentially dropping out of college. In one of our areas, it can take an hour and a half to get to college on public transport, so only the most keen and enthusiastic of students is going to do this 3-hour round trip, particularly through the winter. It's also more expensive to provide healthcare in rural areas. Funding mechanisms don't reflect older and more sparse populations, and both the health sector and businesses in the rural areas struggle to recruit and retain suitably qualified employees. We also know that transport for those living in rural hamlets and isolated dwellings is around £60 a week more than it is for those in urban areas. So in conclusion, the transport and access issues faced by our rural communities and businesses are substantially different to those in more urban settings. We considered various needs or personas and their mobility needs. On the slide you can see two personas on the left-hand column. The first one of those is a rural resident working in a town or a city. Their current transport context may include dropping a child or children off at school or schools on the way to and from work, or they may need to stay away from home during the week as their work is too far away for a daily journey. If communications technology is good enough and their work is suited to home working, this could be an option for them. And our current situation is helping us work out how practical this is. Now, in the case of local service workers, which include supermarket employees, teachers and accountants, for example, they generally tend to have short rural commutes. The technology and other opportunities for them include e-bikes, demand-responsive transport, and connected and effective public transport. The barriers include cost to the user, local roads not always being seen as suitable for bikes, poor connectivity so that providers are unable to provide real-time information on bus location and arrival time, and potential users with the inability to connect to an app to book modern demand-responsive transport. We've seen an increase in shopping online in recent years, which has led to more delivery vehicles on small rural roads serving businesses and residents alike. Demand for quick delivery often means that parcels are less likely to be bundled together, resulting in even more vehicles on the road. If perhaps we had more effective public transport, we could reduce the number of private vehicles on the road, which could speed up online deliveries, and deliveries could be made to rural delivery hubs rather than going to individual addresses. Barriers to this include ineffective bus services and a lack of rural hubs for delivery points. We also considered children and young people who tend to have further to travel to school these days. This means they're often further from their friends and ever more reliant on parents for lifts. The opportunities for young people could include e-bikes and effective connected public transport, but there may be road safety concerns with e-bikes and bus services may not be quite good enough. Some of our older rural residents may not drive, so are more reliant on public transport, taxis or lifts. Access to medical care can become increasingly important as they age. We could suggest autonomous vehicles to get these residents to public transport pickup points or all the way to the service or shop they need to access, but they would need to trust autonomous vehicles. We'd also need to consider whether they had good enough internet access and the skills to organise it. Some would, but not all. We also looked at mobility needs in relation to the varying geographies of our rural areas. As I've already mentioned, the rural last mile may be much further to the final destination than in urban areas and may need a different approach. So at the smallest scale, the last mile, we're potentially looking at demand-responsive transport to help people access their nearest bus stop, for example. In rural villages, we were considering how home working, real-time information on bus and bus apps or websites could all help address issues, along with a village hub which could provide some basic services and bundle demand for public transport. One of the main barriers which needs to be overcome is poor communications, but with the rollout of superfast broadband and improved mobile signals, this will all help. The rural fringes are similar, but may have slightly better public transport and communications provision. It's only really when we look to our towns and market towns that there are greater options and opportunities available to residents and employers. There could be a park and ride available, or at least better public transport provision. At this point, the last mile could be active travel. Rural hubs could be bigger and could provide a wider range of services. We must ensure that settlements link up effectively, from the smallest hamlets to their next nearest villages, to market towns and onto our cities, including our rural cities such as Hereford and Lincoln. We need to ensure businesses can attract and retain suitable workers, and people can access key services. Non-transport related initiatives can also help improve access. This could include home working rather than commuting, that could be full-time or part-time, and Skype consultations with healthcare workers as a first stage in that healthcare journey. But this requires effective modern communications and a willingness to both implement and use these systems. We know that in our rural areas the majority of businesses are very small. Approximately 90% of Shropshire businesses employ 4 or less people, while in Lincolnshire 98% of businesses are classed as small or micro businesses, employing between 0 and 49 people. There can be issues with access for small businesses. The Federation of Small Businesses carried out a study which illustrated that small businesses in rural communities were disproportionately likely to identify poor availability and frequency of public transport as issues affecting their business. Our study, however, has found interesting examples of how organisations have addressed their transport and access issues in our rural areas. We found that JLR, Jaguar Land Rover, has started to bus some of their city-based employees to their rural factories. Kingspan in Herefordshire is working in partnership with Enterprise to provide pool cars for meetings or private emergency use, such as a sick child, all aiming to increase commuting by public transport, so employees get to work on the bus or by train, confident that if they need a car, one will be available for them. Access Lincoln is a behaviour change programme funded by the DfT's Access Fund, encouraging the switch to more sustainable modes such as walking, cycling and public transport, so considering different options. And Herefordshire's Park and Choose scheme consists of 29 locations and facilitates a range of mobility options, including car sharing, transfer from car to bus services, and cycling, with secure lockers at a number of sites. Information including the number of spaces, nearby bus services, availability of lockers, and local cycle routes all help users select the appropriate site for them. Local businesses that are involved in the project have also been allocated free parking spaces. The most popular of the Park and Choose sites are the 5 sites on the periphery of Hereford. These are mostly used by commuters, many of whom park and then cycle into the city. Having considered the needs of residents and businesses, we then considered the current emerging and likely future transport technologies. Autonomous pods are already operating on enclosed sites or closed routes, at Heathrow and a hospital in the Netherlands, for example. However, the university considers them to be unlikely to be on our rural roads in the near future due to programming requirements to deal with human nature, decision-making, variable nature of rural roads, vegetation, and agricultural animals. Crossing the road, for example. Drone taxis and drone deliveries are potentially more practical, and they're being trialled in the Middle East currently, but we would need a change of legislation here to make that viable. 5G, superfast broadband and mobile coverage are all crucial as enablers to provide real-time information for buses and reduce user anxiety, and we know that Wi-Fi in buses increases patronage. Communications can also facilitate lift sharing apps and also car clubs based on apps and websites, but we also need to be aware of the 10% of people who don't use the internet. Non-technical options include the Wheels to Work scheme and coordination of public sector budgets to maximise the use of current assets, and also hubs, which were raised at workshops and seem to be gaining in popularity as an idea. Hubs can be at various locations. They could be at key junctions, they could be on the outskirts of market towns and within villages and hamlets. They could provide a range of services depending on scale, so transport pickup points, delivery drop-off points for internet orders, healthcare provision such as blood pressure checks. They could provide shared workspaces and meeting rooms for small rural businesses to hire. It's important to point out, though, that we're not looking to hubs as a replacement for existing shops and services that are in our rural areas. Rather, we would like to support and enhance the existing provision. We see hubs as a place which can provide a service. You could get your physio treatment there rather than having to trek to the hospital potentially. Then, having had the service, you could then hop on a bus to your local market town, get your groceries, meet a friend for coffee, or attend a business meeting before getting the bus back to the hub. The study generated quite a number of recommendations, which we split into 3 subsections: fresh approaches, new technology, and improved regulation. So under fresh approaches, we recommended the need to investigate the potential for hubs to allow improved connectivity. In terms of new technology, we thought it would be useful to investigate the use of digital infrastructure to support improved bus services and subsidise smaller operators on less profitable rural routes. And there needs to be a review of regulation, particularly for the likes of e-scooters and e-bikes, so that they can use pavements. But we also need to help national policymakers to take into account many of our hamlets and villages don't have those pavements. We also recommended better use of data in planning transport provision, and a review of national transport related budgets to allow greater sharing of transport provision, particularly across education and health, for example. We are also asking for a national Future of Rural Transport Fund, as we need support from government as well as our communities and industry to enable our rural communities and businesses to thrive. So moving on to the outputs from the report, the university generated a framework of rural needs to link up with the Toolkit. So this slide focuses on the rural needs framework. And unfortunately, you can't see a great deal of the detail. I do apologise. So I've zoomed into the top left-hand corner to give you an indication of what's on the framework. So on the framework, we have a vertical axis illustrating the rural needs. These include accessing key services, education and training, employment, community cohesion, business growth, and health and well-being. And across the horizontal axis, we include some of the tools that could address those needs. This includes enhancing existing public transport, carpools and car sharing, electric mobility, autonomous vehicles, and hubs. There are some barriers to implementation which are highlighted in purple. Some of those barriers relate to the need for good communications, mobile 5G provision, or the appropriateness of an idea to the people involved. So thinking about the less mobile and different ages, for example. So is it appropriate for children to be in shared autonomous pods, for example? So for health and well-being needs, one of the potential solutions is using digital and online innovations, such as having Skype conversations with a GP before actually visiting the surgery. But we must also be aware of social isolation issues, particularly for our older rural communities. The framework is designed to provide options and ideas, it absolutely is not prescriptive. Each rural area is different and has different needs, so options which are relevant in one area may not be elsewhere. Excuse me. Within all of these options, we need to consider internet non-users. So between 11 and 12% of people in the Midlands have either never used the internet or haven't used it in the last 3 months. Over half of those internet non-users are over 75. So we need to also bear in mind our ageing rural populations. Interestingly, 12% of 11 to 18-year-olds don't have access to a computer or tablet at home, but I wonder if that's because some of them have smartphones instead. So throughout the study, we considered new ways of moving people, reducing the need for people to move, and also changing how services are provided, including looking at taking goods and services to people. So here's an illustration of the resultant toolkit. So the printed version of the framework and toolkit is one A3 sheet of paper with the framework on one side and the toolkit on the other. It's designed to be a really quick illustration of the needs of our rural communities and of the options or tools which could be considered when planners, transport planners and others are looking to improve rural mobility and connectivity. So again, many apologies that you can't see much of the detail from the toolkit, but I've zoomed into the Hamlet section to hopefully provide you with a bit of an indication of what's on there. So it's an illustration of a hamlet. It's not a hamlet in reality, and the white blobs with the numbers in it are replicated on a key on the main toolkit, so you can see what they say. But as you can't see what they say, I'll give you a few examples. So one, that is a multi-use space. So the building actually looks like a church with a little tower. But the idea there is a multi-use space could be used for meetings, it could be used for education, it could be used in small areas where there are private desk areas. We could have business meetings in there, for example. To the right of that is an autonomous delivery pod making its way to make a delivery. 13 is to represent effective communications, whether that be Wi-Fi, 5G, mobile phone signal. 3 to the right of that is the telephone triage or Skype triage that I was mentioning earlier. And then back to the far left, number 6 is a drone delivering something. 14 are secure delivery lockers, which can be in a variety of sizes. And 15 is real-time information provided at the bus stop in the hamlet, which then links to the market town, which is on the bottom left-hand side of the full toolkit. So that's the output from the study, all of which is based on the premise that the areas are well connected digitally. So that's key to this work, really. So looking to the future, because hubs have seemed to gather a great deal of interest, and it was a recommendation in the study that they needed to be investigated further, that's exactly what we're doing. So we currently have an invitation to quote out, inviting organisations to work with us. What we want to do in that phase 2 of the forms work is look at aspects such as the demographics, the locations, the needs and the commercial viability aspects of a rural mobility hub, where they might be, where they might work best. And we hope to be able to report on that work later this year. So that's me, but I'm happy to take questions if there are any. Thank you.